When joint pain gets to the point of stopping you from your normal activity, it is time to see a specialist. The doctors at Orthopaedic Associates of Central Maryland have been giving people their lives back for more than 50 years. Just about half of the age of their latest patient. Take a look. Colonel Alfred Shahab sounds like a man who just won the lottery.
I'm starting a new life at 100 years.
That's because a couple months ago, at the age of 99 years and 10 months, Orthopaedic Associates of Central Maryland provided the surgery he needed, but thought he wouldn't get after a visit elsewhere.
And this chap came out and said, you're a good candidate for a hip replacement. But he said, I don't do that. You're too old.
And what did they tell you when you came here, that they could do it?
Yes.
That doctor is orthopedic surgeon Dr. Nick Grasso of Orthopaedic Associates of Central Maryland and a fellow Army veteran, just like Colonel Alfred Shahab.
He was absolutely miserable. He literally couldn't get out of a wheelchair. And the care he had received up to then had been completely appropriate. He had been treated with medication, he had been treated with cortisone shots, he had been treated conservatively, and it all failed him, and none of it really worked for him. So it was kind of a quandary that what do you do with a guy who's 99 years old and who is in this much pain? The options were basically either to attempt a hip replacement knowing it was really high risk, or to let him live the rest of his life in a wheelchair. And here's a gentleman who is completely lucid, as lucid as you and I, who we could hold a conversation with, just like we're having this conversation now. And we had that conversation. The big catchword in medicine right now is something called shared decision making. And after discussing it with him and his family and his significant others, the decision was to attempt the hip replacement, even though they knew it was very high risk.
My God, it was unbelievable. When you have this sort of thing and it doesn't let up, and then you get up out of bed or a chair and you get up, there's no pain. I don't have pain here. Well, I have healing pain, but not pain.
What would you say to your doctor who gave you that back, where you can get up now and you don't have pain? What would you say to him?
Thank God. I wanted him to understand that it's a rather ticklish thing. This pain had been with me never ending, and I can't live that way. I told my regular doctor I can't live that way. I told the cancer doctor I can't live that way. I'm better off dead. I didn't say that, but I said I'm better off otherwise. And this fellow, let's go. The minute I met him, I had a feeling this is going to work.
So who is a good candidate for joint replacement surgery?
But when it's limiting your lifestyle, when you're not doing things you want to do because of your joint, if you love to go out with friends for dinner, but your hip hurts so bad you just can't get out the door, it's time to do something, at least get looked at. You know, not everybody needs a joint replacement. Some people can be treated conservatively with either medication or injections and do very well for years. I have patients who I've been treating for 8, 9, 10 years who have bad arthritis on x-ray, but they with conservative treatment, they're doing fine.
For those who need surgery, though, Colonel Shahab says there's no better place to go than Orthopaedic Associates of Central Maryland, which is celebrating 50 years in practice this year.
It's actually pretty amazing, because when I first joined, there was only 5 partners. Okay, now we're up to 16 practitioners, 3 locations. The building that we're in now in Catonsville is one that we built ourselves because we just outgrew our other spaces. And it's a great group of people.
What are you able to do today, now, pain-free, that you weren't able to do before the surgery?
If I was stronger, I could chase you around the room. I could sit, I could stand, I could, whatever. I could do things I used to do within reason.
For 100 years old, he looks great and he gets around very well, uses a wheeled walker, but the fact that he came back and told me he's completely out of pain is just very gratifying.
It's wonderful we have doctors like folks.
For more information on Orthopaedic Associates of Central Maryland, check out mdbonedocs.com. We'll be right back right after this. Stay tuned.